I'm not going to ask questions. I'm going to list some of my priorities for the Department of HHS. When I'm done, I'm going to save some time for you to respond if you want to respond of agreement or disagreement. My first point is something that Senator Crapo ended with. A key responsibility of each member of Congress is oversight. Oversight allows us to hold bureaucrats accountable to the rule of law and helps keep faith with taxpayers. I expect HHS to provide timely and complete responses to congressional oversight. Secondly, dealing with pharmacy benefit managers. Since 2018, I've been working to hold pharmacy benefit managers accountable in order to lower prescription drug costs. I expect HHS to work with Congress to do the same thing, accountability. Hopefully even support legislation that I hope comes out of this committee later on, like it did last year. On rural health care, I expect prioritizing of health care needs for rural Americans, including support for rural hospitals, clinics, rural pharmacies, rural health care workforce, and improving maternal and child health care. Organ transplant system reform in a bipartisan way. We need confidence that our organ transplant system is efficient and fair. I would like to see HHS fully implement the bill U.S. Organ Procurement and Transplant Network law and do it properly. This law improves the management of our organ transplant system and establishes some competition. The fifth one would be qualified foster families. Across the United States, there's a shortage of such families and retention challenges among families that do open their homes to children in foster care. Senator Hassan and I have introduced a bill that is entitled Recruiting Families Using Data Act to help address this and avoid unacceptable temporary placements of children in settings such as office spaces, hotels, and the like. I expect HHS to help states address the challenge of recruitment and retention among foster families so that children aren't placed in unacceptable settings. And lastly, improving outcomes for older youth aging out of foster care. In January, the Government Accountability Office published a report to understand how states are using funding from the John H. Chafee Foster Care Program for successful transition to adulthood. That's a long name of a program that we have in place. I requested this report after I became aware that some funding was going unused and being returned. I expect HHS to work with me to build on the successes of programs like Chafee to ensure that our resources provided are used to effectively support older children in their transition to adulthood. You have 1 minute and 17 seconds if you want to respond.
Thank you, Senator. If I could say, when I worked at HHS during the Bush administration, I vividly remember you were always a very consistent voice on congressional oversight of HHS and the whole government, and I thank you for that. I think that is an appropriate focus, and I look forward to working with you to make sure that all members of Congress and their staffs get prompt and consistent and accurate information about the department. I'm sure Gary would agree with that. On foster care, the Administration for Children and Families, as you said, has a deep responsibility to ensure that state and other programs related to foster care are ensuring that all foster children have access to good, loving families, and that is a priority for me, and I look forward to working with them.
Senator Grassley, thank you for stating those priorities. I know those are consistent with when I met with your staff, and they emphasized all those things as well. So appreciate you reiterating them. I do know of you, you have a long history of interest in oversight. I look forward to working with you on that. I know that there's bipartisan interest on PBM reform. I look forward to working with you on that. And I know from speaking with a lot of the other members of this committee that rural health is a priority for you as well as others. So look forward to working with you on all those things.
Okay, thank you. Mr. Chairman, thank you.
Thank you. Senator Cassidy.